Hello everyone. Today we are going to see about Holter monitors. Holter monitor is a small wearable device that keeps a track of heart rhythm. It uses a surface electrodes for recording a heart rhythm. This process will be happened around 24 to 72 hours, the recording process. This is sometimes also called as ambulatory electrocardiograph. This invented by Norman Holter in 1957 for recording an ECG activity of a heart. There are different type of ambulatory cardiogram monitoring are there. They are Holter monitors, event monitors, ambulatory real-time cardiac monitors, adhesive patch electrocardiographic monitors, implantable loop recorders. How this Holter monitor works? Normally, this Holter monitors are slightly larger than the tech of playing cards. They're having wires that are attached to the monitors. The leads made up of stainless steels are placed on the chest using a glue-like gel. They are used for improving the conductivity, and the metal electrodes are conducts the heart's activity through the wires into the monitor, where it is recorded. It has a uses of patients experiencing a daily symptoms and precise quantification of arrhythmias. Mostly the people who are consequently having any abnormalities in ECG rhythm, they will use this Holter monitors. These are very useful for 24 to 48 hour full disclosures, and heart and AV burden graphs are monitored, and also arrhythmia counts are also monitored here. It has a disadvantage because sometimes this 24 to 48 hours is in a very short duration. Sometimes it will create an artifact because the patients are using that holder for a long time. So if there are any mobility within the patient, it will create artifacts. The patients are prepared by using these ways. Their skin are prepared for replacement of electrodes, and they have to wear the monitor for 24 hours per day for the entire length of the process. They can do the normal activity except those that involve with the water, and the monitoring part do not be wet, so they have to stay out of the water, and the recording activities they have to be noted in a diary when the arrhythmia is happening, and what are the surrounding activities is they are doing like that for diagnosing purpose. And they have to avoid the things that create the interferences like magnets, microwaves, electric blankets, cell phones, and mp3 players. And they have to follow the instructions provided by the monitors user guide. That is, they have to follow the procedure for about 24 to 48 hours. And while monitoring that Holter monitors, we can able to know the findings like heart rate histogram, bradycardia events, ectopic beats, and ST and T wave changes, and QT analysis, heart rate variability, and rhythm strips, and sleep apnea for about a 24-hour trend. This can we can able to see using that Holter monitors. And this is a report summary displayed here. The patient with a heart arrhythmia, while they go for a Holter monitors, this report will be like that only. It has patient name and like the basic informations are here. Then 6 boxes are there here. Each one depict that heart rate and ventricular yeah, events and heart rate variability and segment analysis and ventricular patient ventricular events and bradycardia, everything. If there is any deviations in that, it will be displayed here. Next, the bradycardia events. If there is a passes exceed 2.5 seconds, and this will be displayed in the QT summary. And sometimes there are 460 millisecond. If it is QT elevation will be happen, then it also lead to some of the problems. Okay, then below that, that is a mini easy stripper. That is a general impression. It will denote the all the monitoring event happening above. That is 6 events. It is displayed as a graph. It is a 24-hour trend. In this trend report, the second page, in this ST, HRV and HRV power, VE beats, everything is monitored here. Then bottom half shows hourly counts for heart rate, arrhythmias and passes and ST. The top heart rate graph is maximum, average and minimum heart rates of each minute during a 24 hours Holter wearing. The next trend is the ST segment. If the ST is more than 1 millimeter, the maximum ST is shown on to the right. The next two trends are variability and other things. The next two trends are also arrhythmias VE and SVEs for about are displayed here. And arrhythmias which are monitored using halters are give the warning signs. Sometimes if it is has a ventricular rhythm disturbances or arterial disturbances and frequent and complex rhythms are there, then second or third degree blocks or sinus passes longer than the 2.5 seconds, and marked bradycardia during the waking hours. While they are waking up, if there is any bradycardias and tachyarrhythmias are there, these will give the warnings during the whole